Well, hello everyone, and welcome to Health Chats Among Friends. This is Deidre Kindred. I'm your nurse advocate, educator, and navigator. And tonight I have the true pleasure and honor of speaking with Irnise Williams and Sue Wallace. Sue Wallace is going to be listening in with us as a co-host, and Irnise is going to, she's in New York City, everyone. So I am super excited to hear her perspective of during COVID. But before we get into that, I'm going to let her tell you a little bit about herself. Irnise?
Awesome. Thank you so much. So, yes, I'm Irnise Williams. I am a nurse. I've been a nurse for 14 years. Although I am also an attorney, I always consider myself a nurse first, just because of my heart and what I know I've been called to do. But being an attorney definitely has its perks as a nurse. And I've been in healthcare. I've worked in almost every department in inpatient, outpatient, home hospice. So I have lots of healthcare experience. Over the last year, I worked in the hospitals in New York City and in Maryland because of the pandemic, which gave me a very unique view into all the things that many of us know and experience of the stress of healthcare, but it definitely was exacerbated. And I think what we experienced in this last year is what most advocates have been talking about for many years that we knew was going to happen if this pandemic, ever happened, right? So, being an attorney gives me a different perspective as to healthcare and how we manage healthcare. Because for me, my perspective is to protect the patient and the provider, which can be difficult, and especially during a pandemic where everyone's very much stressed and short staffed. So that's kind of a little bit about me and what I do. I help healthcare providers protect their license through helping them with business support, starting businesses, protecting their businesses, as well as creating courses to help educate healthcare providers who are in direct patient care.
So somebody asked me, when do I sleep? When do you sleep?
I don't sleep. I also have two small kids, but I said that tonight I'm gonna try to sleep. I am always listening to books to try to learn, and a book was basically saying if you have more than three priorities in a day, you have no priorities, and so I need to prioritize getting to bed, which is difficult when you're managing so many different things.
Well, goodness, you wear so many different hats. There's so much we could
Yeah,
talk about because we could have you back again and again. Um,
yeah.
but tonight I wanted to hone in on your hat of working as a nurse in the trenches in the hospital during this season of COVID. And you did
Yeah.
mention before how we were already saying that we were short staffed, and now it's just exacerbated now because of COVID. So I
Mhm.
want to get your perspective personally and professionally, what you felt like or feeling like during working in the hospital.
Yeah, so I think, last year I was working in a clinic. We went from seeing hundreds and hundreds of patients a day to seeing like no patients. And it was very weird to go to work and to not take care of patients. And then every single day, the governor was sending out messages and coming on TV saying, we need people, we need nurses, we're so short staffed. And so I was like, I'm healthy, my kids are healthy, my family's healthy. And I was like, I could work in the hospital. And the thought of getting COVID, of course, was really scary. And this was so early on where we didn't know how it was going to impact anyone if you were going to actually survive from it. But I, I took the chance of saying I'm healthy enough. I could probably survive it. So I quit my job in the clinic. I went to work in a hospital, um, one of the bigger healthcare systems here in New York City. And those first few weeks were probably some of the scariest weeks I've ever had in my entire life. Like, I'm a very brave person. And I think most people who work in healthcare, you have to be, because you just never know what you're going to experience when you get to work. But the chaos and the stress and the grief, and just not knowing what to do every single day. There was a new change. The CDC said, you don't need a mask. And CDC says, you do need a mask. And CDC says, well, you need an N95 mask. And now it's like, any, usually we would throw, anytime you come out of a room, whatever you have on goes in the trash. N95, regular mask, PPE, whatever. But the fact that now we're reusing it, which then essentially is contaminated stuff that you're
Mm.
putting back on, was very scary for any of us who were knowing like this is dangerous. And then people began to get sick. So the staff began to get sick. The hospital I was at was one of the first places where some of the first patients were. So some of their staff got it very early on. And at that time, we didn't know what to do. And then once some of their staff members actually passed away, the anger and the bitterness and the stress of that, and still trying to take care of people, it was a lot. It was, I think, more than nobody could have expected or predicted any of that. And so I think those first few weeks were scary. And then it went from we're taking care of all of these patients to like there's nobody here. Like right. It was like, all elective surgeries were canceled, all any type of outpatient procedure was canceled. And so now you're really just stuck with people who either were recovering from COVID or were coming in with COVID. And so essentially the hospital, some units became empty. Like if you weren't in the ICU or you weren't actively dying from COVID, there was nobody there to take care of. And so my first assignment that I was at, I was canceled because the hospital was empty. And then I went to another assignment where it was busy and things started to clear up, but it was still very chaotic because now people are coming back to the hospital who had delayed their care. So, I was working on an oncology unit. Those patients are usually in and out of the hospital
Yes.
often. They were so scared to come in. Now they're coming back and their numbers were so bad. And so now we're just, blood and plasma. And it was a lot. It was so many things. So I think, when I think towards the end of the summer last year, where things kind of started to settle down and all of our adrenaline began to settle, nurses began to feel very angry. We felt very much, nobody, like a hero is someone who can actually protect themselves from something bad happening to others. And so you don't necessarily feel like a hero when people are dying, when your colleagues are not, mentally or physically well. And so it was a lot of anger, a lot of bitterness, a lot of trauma that has definitely been unaddressed with very little in-house support. So all the social workers, all the psychiatrists, all of the mental health workers are working from home, but all of the staff who actually need their support are on the units with no one to support them. So it has been, and it still continues to be a very difficult time. And I think people are very much lost at what to do next and to how to rectify what happened. I don't think any organization or leadership has apologized to healthcare workers, has spoken up and spoken out about some of the missteps in the beginning that essentially made people sick. Nobody's taking responsibility or accountability from that. And I think that is probably it's like secondary trauma to some people who are already traumatized. So it's definitely lots of healing that needs to be done, as well as just kind of a new plan of how do we move forward from such a long-standing traumatic event.
Right. Wow, that is powerful. I'm so glad that you are sharing your personal perspective because I feel like sometimes as nurses or healthcare professionals, they forget we're human.
Mhm.
They forget that we go through emotions of fear and anxiety and loss
Mhm.
and resentment. And,
Mhm.
you know, it takes courage to do what we do.
Yeah.
But I think now that we've gone through this season of COVID, and we're learning a little bit more, but we still got a long way to go
Mhm.
as
Mhm.
far as the respect that we
Yeah.
don't get.
Yeah.
You know,
Definitely.
definitely. But I really commend you from for your service because I haven't been at the bedside since 2016, and I applaud you because I wasn't going back. I
Okay.
wasn't going back because it's just like
Mhm.
it was already so bad working there without COVID, shorthanded, the inconsideration of administration, you know,
Yeah.
just not caring
Mhm.
and it's
Mhm.
dangerous, for your
Yeah.
license. I'm not an attorney, but I was a legal nurse consultant, so I did get to sit on a few depositions and things like that. And the hospitals, I'm sorry,
They'll throw you under the bus.
they will.
Mhm.
They will. And
Mhm.
you and I could have a whole nother chat about how
Yes.
nurses really need to protect their license. But
Definitely.
I want to go back to you, and
Yeah.
because you have a family also. So,
Hmm.
what did your family say when you first chose to go back into the hospital?
Yeah, so I got COVID when I was still working in the
Oh,
clinic. And my husband and like I knew I had it, but they still weren't testing. I just lost my sense of taste and smell. And I kept trying to just act as if I didn't have it. Like I just kept trying to work out and eat and things like that. And so at that point I was like, well, I already had it. So what's there to lose? And my husband was very much supportive, like, this is something you want to do, I'm gonna support you. And like my older son kind of understood. And then when I would come home, I'm like, don't touch me. I gotta get out of my clothes. I gotta shower,
right,
taking off everything at the door. So they kind of got used to that
right.
experience. But it was definitely, I think, just a decision that we had to make as a family. You never want to sit somewhere and say shoulda, coulda, woulda.
Right.
And so it was just, as a family, my husband and I decided it was just worth taking the chance to do it because it's something I said I wanted to do. And he knows how I am. Like if I don't do it, then I would just be sitting in regret, like wishing that I
Mm-hmm.
did. So
Mm-hmm. Mm-hmm. Yeah. Wow. So you can see both. So it's something else working in your position, because when I got my certification as a legal nurse consultant, I looked at stuff a whole lot differently, right?
definitely.
Because
Yeah.
you're looking at both sides. You're looking at the patient side aspect, and
Hmm.
you're looking at the caregiver aspect. And
Hmm.
I can't help it. Everything I look at, I'm like, okay, legally, okay,
Yeah,
it's just you analyze everything you
definitely.
do, and
Hmm.
so did COVID kind of heighten that fear of, oh, litigation? Did it kind of heighten that at all?
I think, there was so like every day was a new rule. So for a few
Yeah.
weeks it was skeleton charting, which was like just
Mm,
vitals. Like as long as you
wow.
had a set of vitals in for the shift, you didn't have to do Q2 hour turns, you didn't have to document this, you didn't have to document that. For me, I was like, I'm never going to play with skeleton chart. And no, thank you, right?
Right.
Because
Right.
if you're ever in a situation where there are questions, you don't have anything. You don't have documentation to even remember that patient that you care for. You're never going to
Mm,
remember. Um, so I thought that was very interesting that they went to that form of charting, and then it was like a few weeks later, they're like, oh no, now we're regular charting, but everybody didn't get the same thing. So some people were still skeleton charting. So
oh my.
um, and then it was like you couldn't take the machines in the room. So you were having to get all your medication, scan the patient's armband outside of the room, then take the medication in the room. So you just start taking shortcuts that could then lead to errors, right?
Yeah.
And I think for me, that's what kind of got scary. I'm like, we're moving in a way that we never moved before,
Right.
regardless of if we're short staffed or not. In that instance, we weren't because it was a lot of travelers. There were a lot of travelers there, but I was just like, I hope we don't take up these bad habits and take them with us forever.
Right. Right.
Not um, doing our five rights and not making sure that the patient understands what medication that they're taking. There were huge language barriers. There was just so
Mm,
many things happening. And so, being in a situation where now it was just changes every single day, it felt very dangerous. They said, like, oh, you don't have to worry about being sued. But New York just lifted that ban for nursing homes a few weeks ago. So we don't know what's going to happen, what type of litigation is going to come out of that. And based on what I know that it happened in New York, if people are allowed to sue, it's going to be pretty extensive.
oh my. Wow. So, because New York, you guys were hit really, really hard
Yeah.
with it. Texas is big and we're spread out. So, I doubt we were hit as hard. Well, you know what? We were number two for a little while there according to the CDC. But oh my goodness, I can't imagine the subways and when it was really in the midst of it, where it's just like
Oh
a
yeah.
ghost town.
Oh yeah. Things emptied out really quickly. It was actually scary to get on the train when nobody's on the train because now you're on the train by yourself, which is unheard of. usually, people start going to work 3:30, 4:30 in the morning in this area to get downtown, especially like construction workers and MTA workers. And so to see nobody on the train or, just out and about, it definitely was really scary. And then as things started to pick back up, now you're like, oh my God, it's a lot of people in here. Like, so you kind of you don't want it to be empty. You don't want it to be full. But yeah, that's definitely been like a challenge for the transportation system, trying to stay open for the people who need to get to work, but not really running at full capacity, which meant they were just losing, a lot of money. So yeah, that part was definitely challenging as well, just kind of navigating being in the city.
Wow.
Bernice, could I interject something or ask a
Yeah,
question?
of course.
Since we've been through the pandemic, I mean, we're still in it, but it seems like we're getting a little bit on the other side of it. Do you think that we have learned that it's possible? And so we do need to set up standards of care about what we would do were we faced with something like this again.
I definitely think that there are lots of lessons learned. Do I think that people are actually implementing or taking action on those lessons? I don't think so. So for example, nurses don't have to be tested. If you work in the hospital, you could have gone a whole year without ever being tested. In a nursing home, they're testing 1, 2, sometimes 3 times a week, trying to protect the patients. And so,
Oh, wow.
it's like, how can those who are taking care of the critically ill not be tested at all, not even once a month? And then
Oh,
those who are taking care of
wow.
patients in the nursing homes are tested. And so
Right.
we may be the ones who are actually spreading the disease and not even realizing it. So I think that is one thing that I noticed that I think is a huge challenge and a big issue,
Mm,
as well as, the miseducation and the misunderstanding about what the vaccine does and who should be taking the vaccine and how many people we need to take the vaccine for things to actually move forward. I just think that there are a lot of lessons that we have learned, but the actual implementation of change has not happened, is not happening, as far as supporting frontline workers and staff in the healthcare setting, not happening. There's very little mental health support, which I think is the number one thing that healthcare workers need, and not a hotline, not somewhere where you have to make
absolutely.
phone calls. They need
Mm-hmm.
therapists on the units, on the floors, being able to provide day shifts and night shifts,
Mm-hmm.
actual hands-on support.
Right.
And that is not happening. This is Nurses Week, and it's kind of like, okay, maybe we're celebrating, maybe we're not. There's still
Mm-hmm.
no appreciation for the sacrifice of what CNAs and nurses and janitors,
Mm-hmm.
every
And
person who works on the front
housekeeping.
line,
Yeah.
housekeeping, who had to go in there and clean those rooms, like there's not enough appreciation and respect for that. And so I think that is a huge challenge when you go through such a traumatic situation and everybody kind of moves forward as normal. I think that's very challenging for a lot of people.
Right. That was a great question, Sue. Great question. I hope, moving forward that we do learn something about
Yeah.
compassion and caring and uh, consideration for fellow man, period.
Hmm.
I've had so many different conversations because I still do home health nursing.
Hmm.
And my patients are basically, they don't have an immune system. They weren't born with an immune system. They have CIDP or something like that. I have one or two that are on a ventilator. They will be on the ventilator all their life. So when people are saying, well, I'm not going to wear the mask and I'm not going to do this and I'm not going to, that government trying, it's not about that. It gets me so upset. It's not about that. It's about that person in front of you. Who are they
Hmm.
going to be in contact with later on?
Hmm. Hmm.
And if that person that they're going to be in contact with, do they have an immune system?
Yeah.
So to me, it's all about, consideration for your fellow man. I mean,
Hmm.
whew, we can go on about, the
Yeah.
value of fellow man and being considerate and kind and understanding the why. And,
Yeah.
but I want to get back to you about,
Yeah.
you being such an awesome nurse to go back
Hmm.
into the hospital setting is because it was
Hmm.
almost like I equate it with a battlefield,
Yeah.
with a soldier, because
Hmm.
only nurses can do what nurses can do,
Right.
right?
Yeah.
And it comes a time when we got to stand up together as nurses and say, no, enough is enough. We
Hmm.
deserve more respect and more consideration and more, appreciation.
Yes, definitely.
Mhm.
Definitely.
Absolutely.
And anybody in the healthcare field. I don't want to negate housekeeping and um, food services and
Hmm.
the wonderful CNAs. I love
Hmm.
my CNAs. I love them, love them,
Hmm.
love them. And the doctors as well,
Hmm.
get
Yeah.
a little bit.
Yes.
Uh, but anybody who is, in the trenches caring for other people, because I can't imagine the PTSD that people are going to have to deal with, you know.
Definitely.
Yeah.
Hmm. Yeah.
So, Arnise, so I wanted to also ask you for the sake of time. So, you mentioned you were an attorney. And
Yeah.
so, what drove you to go ahead and just become an attorney?
Yeah, so I knew that when I finished nursing school, that I was going to get an advanced degree. And of course, people were talking about becoming CRNAs and nurse practitioners, and I wasn't quite interested in going that route. I definitely wanted to add value to the profession, but just wanted to be do something different. At first, I wanted a public health degree, but I thought getting a law degree, I could do public policy as well as potentially legal work, and I wouldn't necessarily have to pigeonhole myself just into public policy. And so I decided to go back and get a law degree and got into law school, was exposed to so many different areas of law that I never thought about, like housing law, and even, civil rights issues. At the time when I was in law school, Trayvon Martin was killed and Mike Brown was killed. And so there was so many conversations about civil rights and civil unrest and, First Amendment rights and what do people have the right to do and not to do. And so I think for me, it really opened my eyes to the depths of injustices in this country and systemic oppression, and how, in so many different ways, if you are born in the wrong zip code, how different your life can be. Um, and I think in times of growing up, sometimes I'm like, well, as long as you have X, Y, and Z, your outcome and your experience should be this. But in reality, one wrong decision can ruin your life forever. And once you're in the system, it's very difficult to come out. If you're ever dependent on the system, it's very difficult to get out of that, because if you make $10 more, you no longer have access to all these services,
Right.
but yet you still don't make enough to afford the full cost of childcare or the full cost of rent, especially in a
Mhm.
city like New York City. So, there's many people who I will work with, and they're like, if I work any overtime, I no longer qualify for housing and I no longer qualify for childcare. And then I can't afford to put my child in daycare because it's $1,500 a week. Right. And so we don't think about those things. We say, well, why would somebody want to be on welfare for their whole life? Or why would somebody want to live in this neighborhood? And the reality is they're stuck. They don't know how to make that much money
Yeah.
to get
Yeah.
above what they're making. And the more money they make, they just fall into this gap of not being able to receive any services. So, you get exposure to that in law school. I think sometimes people think it's all just about like book learning, but you really get to understand systems, and you get to understand how things work in this country and who is essentially running things in a way that you never would have understood if you don't get that legal perspective.
Right.
And so it just was challenging for me to say, okay, how can I put myself in a situation where I can help not just the people who I like my healthcare providers, but also patients, because even with healthcare, the insurance companies are essentially running. The insurance companies are running healthcare. It's not necessarily essentially nurses or doctors,
Mhm.
or patients. It's really whatever the insurance company says is what we have to do to kind of get things paid for or to get
Mhm.
things done. And so some of the challenges are, one, not taking on every issue, right? Because in
Yeah.
some instances, like, okay, I want to work in civil rights and I want to work in housing and I want to help all these different people. But in reality, I had to find my lane and stay in it and really be comfortable with knowing, okay, if I can help the people that I'm sitting here to help, then that's okay, because somebody else has to do the work of helping all these other people. So, yeah, law school has definitely it was eye opening. It was definitely life changing for me. Met some amazing people. I got to clerk. Um, in DC with a judge who I just adored, hear some very good cases, and really get to learn about the Court of Appeal system and how people appeal their cases and what that looks like for them. It is not fun, very intense, but it was a good opportunity, very eye-opening. So when I talk to healthcare providers about protecting their license or about any of the things from the legal perspective, I'm always trying to get people to understand it's not just about how you feel about something, it's about how the law is written. And you have to respect that. And you have to fall within line and figure out how you can navigate life through these rules. I think people want to say, well, I want to do X, Y, and Z. And I'm like, I understand you want to document non-compliant, but what I'm telling you is if you document that, instead of documenting the details, you miss an opportunity to actually educate your patient and protect yourself. Right. And so it's hard for people when they start to hear me talk about some of these things, that they just feel like, well, this is what everyone is doing. And I'm like, that's fine. But when you're called to the table, either through a subpoena or, reported to the board, all you're going to have is your documentation.
Absolutely.
You're not going to have a witness. You're not going to have anybody being able to speak up for you. You're not going to have your manager. You're not going to have a policy. All they're going to ask you is, what did you do and what did you document? And so trying to get that across to people can sometimes be difficult because they just aren't used to hearing that kind of conversation. They're not hearing it in school. They're not hearing it in orientation. They're not hearing it from the hospital staff. And so it's like something new. And it's very, of course, when you hear something new, you kind of want to push back. And I just kind of continue to tell people, like, I'm telling you what's in your best interest, because I know from my own perspective, I have to do what's best to protect myself, because if I'm ever put in front of the board, nobody's going to be there to help stand behind me. It's going to be me and whoever I hire to help me get off, to protect my license and to protect my livelihood.
Well, you are a true hero. And I thank you and commend you for your service. And it's a pleasure to know you and to learn from you. So we will definitely have to have you back, and we could have you back a few times because there's so much that we could
Lots of
talk
good stuff to
about.
talk about.
I learned
Yes.
a lot myself, so I commend you also, and I think that it's anything in the healthcare field. It's about documentation. I learned that because I was in a new industry, at least in Texas, and so we had to learn how to do the documentation also, and I don't mean we've mastered it, but we've come a long way since we got licensed in 2003. But we need people like you that really understand both sides of it, and especially for nurses. So I think you're doing a tremendous job in providing wonderful service. So
thank you so much.
Keep going.
All right, ladies. So Irnise, if someone wanted to get in touch with you, learn more about you, your practice, what you do for the community, what is the best way for them to reach you?
Yeah, so you can check me out on my website. It's www.iwilliamslaw.com. I'm on Instagram, Facebook, LinkedIn, on all social media profiles under Your Nurse Lawyer. If you type that in, you can find me there. But my website also has all that information.
Wonderful. Well, you are my nurse lawyer.
Yes.
So thank you again for tonight.
Thank you,
And thank you, everyone, for tuning in to Health Chats Among Friends, where we bring you reputable resources from your local communities. Tune in next time for another amazing chat.